Good afternoon, everyone. As we present our report on the COVID-19 outbreak in Erie County today, I'm pleased to be joined by the Commissioner of Health, Dr. Gail Burstein, as well as Karen Gambino from Deaf Access Services. The slides, which we'll be talking about, are available to review afterwards on the Facebook and Twitter pages, but because of the new technology, you should be able to see them on the screen easily as well as we move along. We're going to try to keep this short. We did not have a presentation yesterday for Good Friday, and we do not plan on having one tomorrow for Easter unless there was an emergency situation, but we'd like to keep this as short as possible. So just want to remind everybody that the slides and the information that you're seeing is as valid as when it was added to the presentation. It sometimes changes during the actual presentation, but the situation is changing rapidly, and therefore we just want to remind you that what we present right now could change depending on the situation. And for the latest data and guidance, always go to our website at www.erie.gov/COVID-19. We've expanded the public health lab testing criteria, and I'll turn it over to Dr. Burstein to talk a little bit more about that.
Thanks. So we have expanded our public health testing criteria, and along with the other hospitals, we all have a unified testing criteria. So we're looking at symptomatic individuals who are either work in a hospital or a community-based healthcare setting. So healthcare providers, physicians, nurses, NPs, PAs. We're also offering testing to other staff that work in these facilities. So and are in the front line. So people who are delivering food to rooms, people who are cleaning rooms, other laboratory tech or X-ray tech that you may encounter patients in the hospital or the community. So we are testing all those individuals who are symptomatic. We're still testing our first responders that are symptomatic, EMT, fire, police, people that work in corrections. We're also looking at testing the household contacts and significant others of hospital and community healthcare workers. So for that, we would like the healthcare workers to call if they have a household contact, someone that lives in their house, or a significant other that's symptomatic, and to get them tested. We are also we are also offering testing to patients that are receiving any type of dialysis or infusion therapy in the community, because again, they will have to be given their therapy in a different part of the dialysis or infusion center if they're positive. So just again, to help expand and make testing easier, we are not requiring that people have to go through their primary care provider to get a test, because we know many people do not have primary care providers. If you do have a primary care provider, please go through your provider, because they want to know if you're symptomatic. They want to know if you may have COVID-19. So it's really important to bring them in the loop. And if you get the testing through them, if they authorize it and their name is on the rec, then actually they get the results first, and they can give them to you, so you may get the results faster that way. Also, if you do not have a primary care provider and you're going to contact us, still call our hotline at 858-2929, and then press option 2 to speak with someone of the health department that will be helping you order the test. So what are the symptoms that we're looking for testing? So the COVID-19 symptoms are classically a fever of at least 100.4 and either cough or shortness of breath and difficulty breathing. Although we know that some people may not have a fever and have sweats and chills or feel extremely exhausted, fatigue, and we're also hearing that people have a loss of a smell or taste. So I just want to alert people about a lot of scams out there. So remember, the lab world and scientists are busy trying to develop and get FDA approval of different types of tests, including rapid tests out there. However, there is no CLIA-waived, point of care rapid tests right now that people can do in their office for COVID-19. And we know there's a lot of scammers out there offering fake testing or testing that that has not been FDA approved. Antibody tests can be really challenging, and they have a very high false positive and false negative rates. And if they're not approved by the FDA, it's tough to get them hammered down to give good results. So you want to have a test that is good. So you have to make sure that you go through a licensed laboratory. Also, these scams are stealing personal information that could affect your credit card or your bank account. So you have to really be careful. So we really encourage you, if you want to get a test and you're in one of these categories, please call the health department, call your healthcare provider. You might many hospital or healthcare employee health are helping people get tested, or again, your primary care provider. So also want to alert people to false claims about medication. Currently there is no FDA-approved medication to treat COVID virus. There's no medication or any vaccine to prevent COVID virus. So there is no vaccine pill, potion, lotion, lozenge, or prescription medication, or anything over the counter that will treat or cure COVID-19. So there are active clinical trials going on right now, some in Buffalo, that are looking at treating very, very ill people with COVID-19. And hopefully they'll get approved. However, they're not approved yet. We know that every medicine has some serious bad side effects. We know chloroquine can be a very dangerous medicine, especially if it's taken with azithromycin that was published in one small study. That is very likely to cause an abnormal heart rhythm that can kill you. And especially chloroquine can be very toxic to children. So we say that with chloroquine, one pill can kill. So please do not take chloroquine to treat, or any medicine to treat COVID-19. It will only hurt you. We don't know that it will help you.
Thank you, Doctor. I just want to note that we are recommending, when people are out in public, to wear your masks. I have this great mask that was made by Cheryl Moore from our Department of Health, which is a Beatles Hey Jude theme. So thank you, Cheryl. And we do recommend to everyone that they wear their masks when they're out in public. If you're just hopping in your car to go for a ride, maybe you probably don't need it while you're driving, but if you're going out into the store, you should have a mask on to protect yourself as well as to protect others, because you may actually have COVID-19 and not know it because you're not really showing the symptoms. And as has been shown, you don't have to be symptomatic necessarily to shed the virus at this time. We wanted to remind everybody that Senior Services is here to assist you, especially those over the age of 60 who may not be able to prepare or get a hot meal. Home delivered meals are available through our Meals on Wheels program. There's 3 Meals on Wheels program: Amherst Meals on Wheels, Kenton Meals on Wheels, and Meals on Wheels of Western New York. They offer, of course, emergency food assistance. We also have other programs that are available through our Department of Senior Services, including transportation to essential appointments and dialysis for seniors. You should call Monday through Friday, 8:30 to 4:30, 716-858-8526 to sign up for the home delivered program for Meals on Wheels, the emergency food assistance program that exists, the transportation program. There's also health insurance counseling that's available that we offer for free, and home care. So there may be services that a senior might really need home care that we can set up for them. Basic referrals can go to 211, but please do not be afraid to call our senior service staff. They are here. You're not going to hit a call center in India. You'll be talking to someone in the Rath building Monday through Friday at 858-8526. And then volunteers are also needed for a number of organizations across the community. With the greater need for Meals on Wheels delivery, we know that, as well as meal delivery, 2 key organizations, Hearts and Hands and Feed More Western New York, are taking more volunteers. A lot of their volunteers are over the age normally of 70, and those volunteers, of course, are not showing up as often as they may have because they're staying inside to protect themselves. So volunteers are needed for lots of organizations, but especially those that deliver food to our seniors in need. You can call 858-8526 to talk to our Senior Services Department to find more about how you can volunteer for other organizations, but you can call Hearts and Hands at 716-406-8311, or Feed More Western New York, which is the overarching entity for the Meals on Wheels of Western New York organization, at 716-822-2002, and they'll be able to hopefully sign up more volunteers that are needed for this time period. We have something else we have to talk about, which is a high wind warning that is coming on Monday. We have been in touch with the National Weather Service, and I say we, I mean our Department of Homeland Security Emergency Services, as well as the Department of Public Works, for a high wind warning with some fairly high wind gusts being projected into the mid to lower 70s for Monday through Monday night. There's a lakeshore flood warning in watch as well, I should say, for Lake Erie and parts of Lake Ontario. But we want people to understand that you need to be ready, like you are in any emergency situation, hopefully, for if the power gets knocked out. The last thing people want to do when they're stuck at home is have the power knocked out, but make certain you have candles, make certain you have batteries for your flashlights, make certain you have those other key things that you may need in case the power goes out for a few days. So we always recommend that you have at least 2 weeks of prescriptions on hand, no matter when it is, but specifically when we're entering a difficult situation with an emergency because of the weather. But we are monitoring this. I want to thank our friends at the National Weather Service for keeping us updated for what will start on Monday morning and go all the way through very early Tuesday morning, 2 a.m., for a very high wind warning. 72 miles an hour could be very significant. I'm hoping we do not get rain in the next 36 hours beforehand. When you have wet ground and heavy winds, you can have some significant tree downing. I think tomorrow was supposed to be a pretty good day, so that's a good sign, but we do expect it to rain on Monday. And we'll be monitoring this with our Department of Homeland Security and Emergency Services, as well as Public Works, ready to respond as necessary. Please sign up for our Ready Erie account. You can go to any device, Apple or Android, type in Ready Erie, and you'll be able to get our Ready Erie app. We haven't talked a lot about it during the COVID-19 outbreak, but it is available as well for essential information during the COVID-19 outbreak, and certainly would be a key during any emergency weather situation. And beforehand, not only have your pharmaceuticals and your candles and your batteries ready, make sure your phones are charged before Monday. You don't want to be down to 10% power if the power goes out, so make certain your phones are charged and your other devices are charged. Cases, deaths, isolation, and recovered. As of noon today, there were 1,558 total positive cases for all labs. As we announced last night, 57 people have died as a result of the coronavirus in Erie County. We've had no additional deaths today, but I do want to once again offer my condolences to the family members and loved ones of those who've lost someone. This is not a hoax. This is real. I know a number of people who lost loved ones, including my colleague from Dutchess County, Mark Molinaro, county executive. His father passed yesterday. And I contacted Mark and certainly offered my deepest condolences on behalf of myself as well as the people of Erie County. The COVID-19, I should say, the coronavirus doesn't discriminate against anybody. It seems to be hitting certain areas harder, but anyone can get it. Doesn't matter your age, doesn't matter your race, where you live. We've got COVID-19 cases all across Erie County. There are certain individuals, because of some issues they may have health-wise, that are much more at risk for worse conditions, including death. And we want people to understand it can be serious. 57 people have died in Erie County. I don't want to say we're lucky, because any death is one death too many, but if you see what's happening downstate and how on average there's been about 780 people dying in New York State the last few days, almost all of them in New York City and Long Island, we just don't want to get to that point. So stay home, folks. As of yesterday's hospitalization report, 227 individuals were hospitalized. That went up. 121 are in ICU, and 106 of those have an airway assist. I'll just jump up ahead here first to look at the hospitalization chart. One positive is we are seeing, at least over the last few days, in ICU and ICU airway assist, some sort of flattening. We do see a continued growth with regards to hospitalization, but at least we are pleased to see some flattening with regards to ICU and ICU airway assist. Though I do know that one of the reasons we had a drop in ICUs was because of the deaths in the last 24 hours. Remember, this chart, which was released yesterday, is for the day before. So it's for April 9th. This is not today, this is not yesterday, this is April 9th, and we had quite a number of deaths in the April 8th, April 9th period. So There's some positive, but it's not all great. And then going back to the age distribution, you can see when I said that this is not a discriminatory illness, there are people, pretty much all age groups in Erie County, who have had it. And you see it's fairly equal when you talk about 12% to 18% as being the highest. So 12% on the average for 20 to 29 to less than 18% as being the highest for 50 to 59. It can go across all kinds of age variables. So it is not discriminatory when it comes to age. We don't have a whole lot of cases recorded for children. That's a good thing, but we know that children can get it. And as you can see, a number of children have received it or have contracted it. Mapping, Erie County and the New York State Department of Health have their separate maps. New York State does a map daily with regards to the counties. Erie County's in the orange now because we have more than 1,000 cases. Thankfully, we are not in the red like our friends downstate, though our own map shows us in the red because that's just the color we used. One little anomaly that cropped up, Sardinia previously had a case and now it's back to 0, and people are wondering how is that possible. An individual had a Sardinia mailing address but actually lived in Perrysburg in Cattaraugus County. So an individual who resides in Cattaraugus, or lives in Cattaraugus County but had a mailing address to Sardinia, was the one person that was identified previously in Sardinia. After it was cleared up a few days later and found out they actually are not a county resident, they were taken off of the Erie County's manifold, so to speak, manifest, I should say, and put on to Cattaraugus counties. So Sardinia technically still does not have an official case, but we know it's down there, so you should assume it's everywhere. The COVID-19 call center, 858-2929. I'm fairly confident now that I've said that number. They're getting lots of calls downstairs. They always get lots of calls after we talk about the COVID-19 call center. It's open from 8 a.m. to 8 p.m. If you call now, you're going to get heavy volume. You might want to wait a little bit, but only ask questions that are directly related to healthcare, as well as what we're providing through the testing in Erie County. If you have hypotheticals, please don't ask. If you're asking about questions or you want to complain about your neighbor's dog barking, that's a different number to call. Call your police, call 211 for specifics on services. But the hotline is available 8 a.m. to 8 p.m. daily, as well as all of the websites, including the Erie County one, erie.gov/COVID-19. It is updated daily. I'm generally amazed at the amount of new information they're putting up there. There's lots of information for businesses, for individuals, nursing homes, you name it. So if you want more information on COVID-19 and what's best to do, go to our website at erie.gov/COVID-19. Once again, that's the website, erie.gov/COVID-19. With that, we'll open up the phone to questions. Hopefully we can get through this fairly quickly. So with that, why don't we go to the first round of questions. We'll go through the list once more, see if anybody else joined. AP of Albany, or Buffalo. Anybody from Associated Press? Anybody from B News? How about Buffalo Business First? Buffalo News, I believe Steve Watson's on. Are you on, Steve? Unmute your phone if you're on, Steve. I guess not.
Oh, am I okay?
You are on, Steve. Go ahead.
Okay. All right. Great. Thanks. Apologize for that. What can you tell us about cases in nursing homes, either specific nursing homes or overall that population? Have those cases continued to multiply more quickly? And are there any other individual homes that are dealing with an issue as we saw with Father Baker Manor?
Yes, we are aware of additional cases in nursing homes. The Erie County Department of Health is not primarily responsible for those. It's the New York State Department of Health. I don't know, Doctor, if you want to add more.
Right. So we do work with the New York State Health Department, making sure that they're aware and they are conducting disease investigations and helping the nursing homes decide who needs to get tested, including other patients and employees, and then how to help them isolate the ill patients, and helping the staff who need to leave to work leave, and then who are able to come back to return to work. So I know that the New York State Department of Health is being very hands-on with helping those nursing homes, and they are aware where there are outbreaks.
There are nursing home cases in many nursing homes across Erie County. The question is whether it's just one or two or more, and that varies. So I really can't give you the exact numbers associated with nursing homes, but I do know of a number of nursing homes that have had patients. I know of a number of nursing homes that have had deaths. We've always been worried about those in nursing homes because they're the most frail of our population, and we certainly are hoping for the best for any individual who contracts COVID-19, but especially a senior who may be in a nursing home because they themselves are in a worse situation than the average adult. Anybody from Investigative Post? I think we have a call, somebody on from Spectrum Buffalo. Ron, do you have a question?
Yes. My question is concerning Council President Darius Pridgeon. I was wondering if you had spoken to him. Obviously, he has a very big Easter Mass, and I believe that he plans to do a drive-in Mass tomorrow. I know that you previously said that these tend to be a bad idea, and I was wondering if you had spoken to him about that, and if any special measures or anything has been put in place.
I certainly I've not spoken to him. It is the first I know or heard about a drive-in Mass. We deal with a lot of things, but that's the first one I've heard that he may be planning it. Jesus Christ might have rose from the dead on Easter, but none of us are. I'd recommend at best that we avoid drive-in Masses or any other things like that, especially if you're going to be, like as we often do in the Catholic Church, with every Mass, share the body and blood of Christ. This is not the time to do that. We want everyone to understand that it's very important that there are alternative ways to get information out to the public. Including using video for Masses. I will call Council President Pridgeon later today if that's the case and just talk to him, but we are trying to avoid situations that put people together who've been separate, because that's the way that the coronavirus is exchanged, is through community spread. So we've been saying all along, I'm very thankful that the Catholic Church has stopped Masses for the time being, and I know that wasn't an easy decision for them, but that decision has saved lives. And I don't know, hey, if you got to drive up Mass and someone's got to go to the bathroom, do they get out of their car and do they try to go to the bathroom? I mean, things like that. You got to think about these things that are serious issues. So I would not recommend, and we are not recommending drive-up Masses of any type. Are those in the Jewish faith basically had the most strangest Passover the Seders will ever have. And I would ask that our friends in the Christian faith, of which I am one, do the same for Easter. I would much rather see people alive celebrating Masses at a future date than dying because they contracted the coronavirus and died of a COVID-19 related illness because they went to a Mass. Next question to WBEN. Is anyone on? WBFO, Ryan?
Yes, hi. My question is pertaining to public transit. A lot of people in Erie County rely on public transportation. Do you know if the NFTA is requiring passengers at this point to wear masks or take extra steps like that?
I do not have an answer to that question, whether they're requiring them to wear masks. We have certainly are recommending that everyone wear masks when they're in public. I do know that the NFTA has been addressing issues with reducing the number of people per train or bus, and they said that 99.5% of their cars and buses had less than 15 passengers and 94% had less than 9. We certainly know that people have to get around for essential jobs, and for some of them the only way they can do it is through transit. So it is only for essential people. It's not for joyriders. The individuals who are going may be coming to and from, especially from a healthcare setting where they've been exposed to COVID-19. So you don't want to be on the train if you don't have to. And we would certainly recommend to everyone, when you're out in public, wear a mask. WBLK, is anybody on from WBLK? WGRZ, Leanne Stuck.
Hi guys, my question is bouncing off a previous question in regards to the Easter holiday tomorrow. We've seen in other communities that leaders have closed down parks for the Easter holiday in response to word about people potentially gathering in parks to do Easter picnics or whatever else. Is that something that you guys are considering with Easter being tomorrow?
We're not necessarily considering closing the parks, but if we saw mass congregation, and we've had people try to do masses in our parks before, we will shut them down. Our parks rangers and Erie County Sheriff's Office are empowered to do that. So if anybody thinks, well, I'll go to the park and we'll, like Chestnut Ridge, and we'll sit on the hill all spread out, that ain't going to happen. The parks are still open. We recommend that people use smart social distancing practicing, but if we see what appears to be an attempt by a church to do a mass of some type in our parks, we're going to have to break it up. So it's just better to do the online ones. It may not be what we prefer, but it's the safest way. And I really want people to understand there are people dying from this in our community across New York State. We are seeing community spread of individuals who are dying because they got it from someone else. And this is serious, and you need to take it serious. I understand how important Easter is on the Christian calendar and to Christians in general, but I mean, if the Pope can reduce and have no people for masses, I mean, we can do that here as well. WIVB, Channel 4.
Hi. We've heard from a number of funeral directors who are frustrated that they're not among the groups being considered for COVID-19 testing. They've expressed that these are the folks who may be handling the bodies, people who have passed from the virus, as well as going into the homes of the immediate family members of those people. Why aren't they eligible for testing?
So turn it over to the doctor.
Sure. There are, we are expanding testing, and I acknowledge they are important in our community. And we're hoping that after this week, when the laboratories get additional capacity and we feel comfortable what our numbers are with our new updated guidelines, that we'll be able to expand testing to all essential employees. So that would include people working in funerals, funeral homes, people that work in grocery stores, people that work in pharmacies. We just want to make sure that we're comfortable first with what we've expanded to now, because again, the testing, it's the only way it works is that people can get results in a very short period of time. And so if we open it up to the if the community labs open it up too broadly without preparing, then people won't be getting their results in a timely fashion. So, and it won't be helpful. So that's a great point, and we're hoping that we will be able to offer all those categories of individuals testing in the very near future.
I am thankful we've been able to acquire more test kits from New York State. I also have been pleading for more PPEs for our local hospitals, and we've been given assurance that some are going to be delivered on Monday. And I've already let the hospital CEOs know that, so I consider that a Dingus Day miracle if we can actually get these additional PPEs that are needed in the hospitals. But we understand the frustration with regards to additional testing. There was a question from media directed to me yesterday, have I been tested? The answer is no. I don't have any of the symptoms. I don't have any reason to believe I have it, so why would I waste a test that needs to go on someone who's essential? So I have not been tested, and I just want people to understand that we're testing those that we feel are essential and are symptomatic, and hopefully we'll be able to expand on that sooner. Anybody from WKBW on? Western New York Media? If not, we're going to try to cut this short. So are there any other questions? And if so, can you identify yourself?
I'd like to ask one more. Erica from Channel 4.
Hi, Erica. Go ahead.
I'm curious if you have any thoughts about Cuomo and de Blasio this morning going back and forth regarding the decision, or whose decision it is, to keep schools closed for the remainder of the year.
If you read the executive order of Governor Cuomo, I think it's 202.5, it does prohibit any local governments from doing executive orders without prior approval from the state. They've generally been fine with our executive orders, like the one I did regarding masks. I think that's maybe a fight between the governor and the mayor. But it is true that the state is the one who shut down all schools in New York State, and it would be my understanding that before any school opens, the state would have to approve it. So for now, I've been telling others, we know that there's a pause order with New York State through April 29th, and you should assume that all schools and everything else that's been shut down will be closed through April 29th. So I would just leave it at that.
Thank you.
Any other questions?
Steve Watson, Buffalo News. Can you hear me?
Yeah, I can hear you. Go ahead, Steve.
Okay, great. All right, great. Thanks. Yeah. Just could you elaborate on the PPEs that are going to be coming in on Monday for the hospitals?
Well, we've put in specific requests, of course, for N95 masks because we know that they were getting fairly low on N95 masks. We also put in a request for gloves, face shields, as well. Let me think about this. Gowns. So we're actually, I think most of us are pretty good on procedural masks. I mean, it's the masks that you see that are kind of like this. But the N95s were the big one that was a fear, as well as face shields. Gowns and gloves. We ourselves are getting very low from the supply that we previously had. We've been providing not only to the hospitals 50% of our supply, but we've also been trying to help nursing homes and other healthcare providers out based on the state guidelines. But we've been getting very low, so we're expecting more for the hospitals, and we hope a little bit of that will also be coming as well for county government. As I said, if it is received on Monday, it'll be a Dingus Day miracle. I'll be celebrating with a shot of Krupnik, let's put it that way. Any other questions? If not, we want to thank everyone for your continued following of the guidances with regards to social distancing, physical distancing. We know it's not easy. It is something that we're very, very cognizant of and how difficult it can be as we move on. I want to thank everybody who sent a nice note. Sister Jonas from the Response to Love Center, thank you for your card. That really made me smile. Thank you once again to Cheryl Moore for the really cool Beatles theme mask. We will not be here tomorrow unless there's some emergency that we have to talk about. So to each and everyone else out there, I want to wish you a very happy Easter. Be with your loved ones. Try to avoid the crowds. It is much better to do that. We know community spread is here, and that is how people are contracting COVID-19. So to each and everyone out there, may you have a very blessed Easter if you observe it. Thank you and take care.